everyone. I'm Dr. Bindu Desai. I'm a practicing retail voice surgeon in Western suburb of Borivali. I will be talking about voice problems in teachers. I would like to begin by saying a very famous quote by German Strauss, who was a German musician and a pianist. He said that the human voice is the most beautiful instrument of all, but most difficult to play. Professional voice users are mainly teachers, politicians, actors, doctors, those people whose profession depends upon their voice. Hence, voice is their most valuable asset. It is also the most effective tool for them to convey their expressions, their knowledge. So, just in brief, how we speak. We are all aware about the basic fundamentals of speech, which is mainly respiration, phonation, resonation, and articulation. So respiration takes place at the level of the lungs. The lungs act as powerhouse of air. So when we exhale, when we breathe out, the air from the lungs is pushed out. At the level of the vocal folds, the two vocal folds they act as a tight seal. But because of the pressure from below, they vibrate, and that vibration goes up into the oropharynx, the nasopharynx, and the nose, where these structures act as resonators, and the final articulation takes place at the level of the lips and tongue. Normal frequency of men is around 120 Hz, and that of around females is around 200 Hz. We are all aware that the pitch of females is a little bit higher. So, how does the vocal cord look, or how does the voice box look? So, the image on the right side, we can see whitish structures. They are called as vocal folds. So, vocal folds open up when we try to breathe, and they try to come together when we try to speak. So, here on the right side, we can see that below, when you are trying to speak, they move like the waves of sea. They are moving, coming together, and they are moving like this. So to visualize the voice box, we require two types of scope. Either a rigid scope wherein the scope goes from the mouth inside and the light is directed downwards to see the voice box. And when you put the light, we can see the structure like this, which is similar to this. And the other instrument is the flexible scope. The flexible scope is a very thin, tiny wire-like instrument which goes from the level of the nose into the nasopharynx and the oropharynx, and then we can see these structures. So here you can see me doing the procedure. On your left side, there is me performing the flexible scope. Here the thin wire-like instrument is going from the nose and I'm trying to visualize the voice box. Again, on your right side, you can see me performing the rigid laryngoscopy, where the scope is introduced through the mouth. In the middle, what you have seen me perform is called as a functional endoscopic evaluation of swallowing or FEES. This is basically an endoscopic procedure to assess swallowing difficulty. This is a gold standard procedure to diagnose in patients who are suffering from swallowing problems or called as dysphagia. Dysphagia or swallowing difficulty can arise in patients having neurological conditions such as stroke, Parkinson's, Alzheimer's. The patient can also be having a swallowing difficulty if there is a vocal cord disturbance with regards to its mobility. In these cases, what we do is we put in a flexible scope through the level of the nose and we try to visualize the structures affected during the swallowing and we try to understand which are the structures affected, giving rise to the swallowing problem. And at the same time, we introduce various types of food consistencies, which you can see in the image, and we try to understand which consistency is difficult for the patient and we treat the patient accordingly. So, what will you suffer if you have a voice problem? You may be having a voice change which could be lasting for more than 2 to 3 weeks. There could be a mild throat irritation, there could be pain while talking, there could be mucus like feeling in the throat, there could be lump feeling in the throat, there could be a voice strain, there could be fatigue in the voice. If you are exposed in dusty or dry environment, you are more prone to develop these conditions. If there is a history of a cerebral stroke or Parkinson's disease, you will tend to have a voice problem. If there is a lot of stress, if there is irregular food habits or sleeping habits, you tend to have a voice problem. If there is an upper respiratory tract infection, post-nasal drip, nasal congestion, or allergies, you are more prone to develop voice problems. If you have an autoimmune condition such as rheumatoid arthritis or temporomandibular dysfunction, you tend to have a voice problem associated. Hence, if we have any of these conditions, you would be more prone to develop a voice problem. And hence, even a smallest of a problem, you should visit a voice doctor immediately. Certain health problems could also give rise to voice problems, such as thyroid problem, mainly hypothyroidism. It could be a respiratory disorder. There could be lung problem. If you could be taking certain medications such as steroids, you could be having a voice problem. If certain surgeries have been done for your neck, or there could be a history of cardiac surgery, or any intubation has been done, you are more likely to develop a voice problem. So, what should you do if you develop a voice problem? You should visit a voice surgeon. So what will the voice surgeon do? The doctor will ask you your complaints and he will take you your history in great detail. He will ask you certain specific history such as do you have a voice abuse or a misuse history, what level of water consumption is there, whether do you have a swallowing difficulty associated, whether you are having a vocal fatigue, whether there is any injection of tobacco or smoking or any allergies or any acidity associated. Doctor will hear your voice. Doctor will see whether you are using any accessory muscles for breathing or for talking, such as neck muscles or nasal muscles. The doctor will try to understand the type of breathing that you have. Will also try to check for any oral cavity lesions. Then the doctor will palpate your neck to see if there is any pain or any swelling. And then doctor will proceed for laryngoscopy or stroboscopy. So stroboscopy is a gold standard test to diagnose any problem suffering with regards to voice problem. So when you do a stroboscopy, this is the stroboscopy video. Here you can see the vital structures, which is the vocal folds. Now they will move like waves of steam, and you could see any minutest of a problem giving rise to voice change. And this instrument is gold standard to diagnose voice problem. And we are very fortunate to have the best flexible and rigid stroboscopy system from Olympus now available at Borivali for all our patients. And this is me holding the flexible scope. So as a teacher, what are the common conditions which can affect me? The first is vocal mediums. It is so common that it is also called as teacher's nodules or singer's nodules or screamer's nodules. So here what you can see is the small bumps in the middle part of your vocal folds. These are two bumps which are called as nodules. So they are most likely bilateral. They are present on both the sides at the same level. One could be a little larger or smaller, but they are usually situated together at the same location. Now why this location? But because this is the location there is maximum stress when you speak. And what happens is when you try to speak, these are two bumps will come close to each other and they will hit each other. So that what will happen because of the lesion, the vocal folds are unable to move normally. And the second thing that will happen is because they are meeting, there's a lot of air leak from below, behind and above, which you can see in the video. Here is the video. So here you can appreciate that when they are coming close to each other, the bumps are hitting each other, and there's a lot of air leak. Black thing is the region from where the air is leaking, front and behind. So the treatment is mainly speech therapy. We should try to do proper vocal hygiene program, with regarding which I will talk in the later part of the lecture. Surgery is rarely indicated, mainly if they are very big, if they are resistant to the speech therapy, then that is when we go in for surgery. Now the second is vocal full polyp. So vocal full polyp is a reddish or a pinkish mass, again situated in the middle part of the vocal fold. This is usually present on one side. Now this is mainly because it's a hemorrhagic one. It is a blood-filled lesion. What will happen is because of the swelling, this vocal fold becomes a little bulkier and is not able to move completely, and that is what gives rise to voice change. Here you can see the video. So see, on the right side here you can see the polyp, and that is again because of the polyp, the right vocal fold is unable to move as smoothly as the left one. So the treatment in these cases is surgery. Surgery is done through the mouth, uh, through the microlaryngoscopy, and we remove the mass. The third most common is the vocal fold cyst. So the cyst is basically a fluid-filled lesion situated within the layers of the vocal fold. So there is a swelling beneath the vocal folds. Okay. Again, what happens is because of that, this vocal fold is bulkier and prevents the movement of the vocal fold. So here is again the video. Here on the right side, we can see there is a cyst. Again, the roof is there in front and behind. The vocal folds are not meeting completely. There is a little bit of a gap present. The treatment is surgery in such cases. Other lesions are mainly because of acidity. So what happens is that the acid reflux which happens from the level of the stomach, it comes up in the food pipe and at the level of the vocal folds. So it is this portion. So this is the breathing area and behind this is the food pipe area. So the acid keeps trickling in this region, and because the mucosa at this level is not uh, made for the acidity of the gastric secretions, this gets inflamed, and this gives rise to voice change and laryngitis, which is inflammation of the voice folds. The treatment in these cases is treatment related to the acidity and of course lifestyle modifications. So vocal fold ectasia is another lesion which can affect. So mainly this is a bleeding which has happened within the layers of the vocal fold because of the sudden bout of shouting or vocal abuse. The treatment in these cases is mainly conservative, so you have to take certain medications and voice rest, and it recovers. So this is a laryngeal granuloma, which can also happen. So this main cause of both is acid reflux and vocal abuse. So this is again present in the posterior part of the voice box. So acid keeps trickling here, and this mucosa gets inflamed and it develops a granuloma. The treatment is mainly control of the reflux and surgery. The another lesion is a chronic laryngitis. So chronic laryngitis is basically laryngitis or inflammation that has been happening for more than 3 to 4 weeks. And one must try to identify the cause of the inflammation and treat it accordingly. But of course, prevention is better than cure, and I would not want anyone to suffer from any of these conditions. So this is the local hygiene program, which is directed towards prevention of these lesions. So first and foremost is hydration. Drink lots and lots of water. Water, water, and water. Have at least 8 to 10 glasses of water every day. Try to avoid taking coffee or aerated drinks. Uh, acidity reflux, acidity control is very important, like I have discussed previously. There are so many lesions which can happen because of the acid trickling down in the voice box, and hence we must have a good control of our acidity. We should avoid shouting and whispering, obviously because they are very stressful to the voice box, and hence we should avoid them. In between the lectures, you try to take voice rest. If not required, try to give the voice box rest. Throat clearing, like repeated throat clearing, is a very bad habit, and we must try to avoid it. When we take lectures, try to maintain a good posture. Avoid taking unstable postures while taking lectures. Try to take a good posture while taking. Avoid talking loud in a noisy environment. This is something which happens very subconsciously. If there is a noisy environment, you will try to talk louder, and invariably give rise to vocal abuse. Hence, we should avoid loud talking in a noisy environment. Try to speak slowly and try to use your breath while speaking. So you normally speak when you exhale. So on exhaling, try to speak slowly. Use a mic if possible. If you're school or college students, we should recommend night to all our teachers. This will reduce a lot of your strain and this will improve your quality of lecture. Try to cover your mouth or neck in a dry or cool, dusty environment. So this will prevent dryness of your voice box. Try to have a balanced diet. A positive state of mind is something we must all follow, not only teachers. A good frame of mind is very important. So if you're having negative thoughts, your voice will convey it automatically. Your voice will sound dull. So if you are positive and happy state of mind, it has a very good impact on your voice. Avoid smoking, obviously any active or passive smoking. Smoking is bad and we must avoid it. Exercise is very important, but avoid those form of exercises that require long-term or training. Recommendation would be that all the schools or colleges should have a voice surgeon in the family so that any of the teachers who are suffering from any of these problems could be addressed as early as possible. To end my talk by this wonderful quote by Father of our nation, Mahatma Gandhi, who said that I have always felt that the true textbook for a pupil is his teacher. Thank you very much.